Good day, I am Jessa May Corpus, a nurse student from Medical Colleges of Northern Philippines, and today I will demonstrate the assessment of cardiovascular. And to do that, we need butt blanket or other drift, centimeter ruler, an examination gown, stethoscope for auscultation, and the alcohol for sanitation. So prior to performing the procedure, first I will identify the patient and explain the purpose of cardiovascular examination and answer any question. So, good morning, sir. I am Jessa Corpus, your nurse for today. May I ask what is your name, sir?
Luz Biduque.
And your birthday, please?
September 27, 2002.
Okay, sir. Today, sir, I'm going to assess your cardiovascular. And to do that, I will do some inspection and palpation on parts of your body. Is that okay with you?
Okay.
Okay, sir. Before we are going to proceed, may I ask you some question? Okay. Do you have history of chest pain, tightness?
No.
Do you feel swelling in your ankles and feet?
Not.
How many pillows do you use when you are sleeping? How many pillows do you use when you are sleeping?
It depends.
Do you take medicine right now?
No.
Do you have history of heart defect, rheumatic fever, or chest or heart surgery? Family history of hypertension, myocardial infarction, coronary artery disease, high blood cholesterol levels, or diabetes mellitus? History of smoking?
No.
History of alcohol use? What type and amount of exercise do you do?
It depends.
Usual foods eaten each day? Okay, sir. So, sir, before we are going to proceed on the assessment of cardiovascular, do you have any question?
Nothing.
Okay. Now I'm going to assist the patient into the spine position with the head elevated into 30 to 45 degrees and expose anterior chest. Okay, now I'm going to inspect and palpate the carotid artery, the left and right carotid artery, but only one carotid artery at a time. I will use the valve stethoscope to auscultate the arteries. Next. Okay. Now I'm going to inspect the neck for jugular veins distension and observe for pulsation. Sir. Okay, now I'm going to inspect the pericardium for contour pulsations and heaves. And also observe the apical impulses at the 4th to 5th intercostal spaces. Okay, now using the palmar surface of my hand with 4 fingers held together, I will palpate the pericardium gently for pulsations. Remember that hands should be warm and proceed to the systematic manner with assessment of specific cardiac landmarks, the aortic, pulmonic, tricuspid, and mitral areas, and Erb's points. Palpate the apical impulse in the mitral area, note size, duration, force, and location in relationship to mitroclavicular line. Okay, I am going to rub my hand to warm it. Okay. Now I will use systematic auscultation beginning in the aortic area, moving to the pulmonic area, then to the Erb's point, then to the tricuspid area, and finally to the mitral area. And I will ask the patient to breathe normally. The stethoscope diaphragm first used to hear the high pitch sound, followed by the bell of the stethoscope to hear the low pitch sounds. Focus on the overall rate, rhythm of the heart, and the normal heart sounds. Okay, first I am going to use the diaphragm of the stethoscope. Okay, next I'm going to use the bell of the stethoscope to hear the low pitch sound. Okay. Now I'm going to replace the patient's gown and assist the patient to a comfortable position. And perform hand hygiene.